Mr. John, you have the floor for 5 minutes, please.
Well, thank you. Thank you so much, Ms. Matviachuk, for being here, for your courage and strength and leadership through this terrible tragedy. And we had Darka Harnik, a young, strong woman, Ukrainian intern in my office, and really helped provide us some insight about the courage of Ukrainian women through this crisis. I guess I want to start with, children. We've seen and heard about 19,500 Ukrainian children that have been abducted and taken to Russia. What can Canada do to help return the abducted Ukrainian children of this war against Ukraine?
Canada is leader of international coalition of returning of Ukrainian children back. That means that Canada can initiate a lot of actions which can be taken simultaneously by states which are members of this international coalition. For example, we can speak about sanctions. We have to demonstrate that people who are involved in this genocidal policy to take Ukrainian children to Russia to bring them up as Russians will be punished. Also, Canada can address to Deputy of General Secretary of United Nations, who is responsible for children in the war, with a request to provide a status of abducted child for Ukrainian children in Russia before till the moment when their whereabouts and their destiny will be identified and solved. So Canada can do a lot, and also I will focus on something which Canada can provide for children in Ukraine, because children are going through the experience of the war, and this is a very horrible experience. And they need a lot of psychological help. And now we have a lack of mental specialists in Ukraine for providing this help. And just to understand the circumstances, I will tell you a story of one Ukrainian children. It's a story of 10-year-old boy Ilya from Mariupol. When Russians tried to siege the city, they didn't allow Ukrainian International Committee of Red Cross to evacuate civilians. Hence, Ilya and his mother hid in the basement of their building from Russian shellings. They melted snow to have water. They made fires to cook at least some food. But when supplies ran out, they were forced to go out, and suddenly they appeared under Russian shelling. Ilya's mother was injured in her head, and the boy's leg was torn. With the last strength, his mother took her son to the friend apartment. It was no medical assistance, because prior to this, Russia destroyed hospitals and the entire medical infrastructure in Mariupol. So in this friend apartment, Ilya and his mother, they were laying on a couch and hugging each other. And they were laying like this for several hours. And Ilya told to my colleague that his mother died and got frozen right in his arms.
I'm very sorry to hear that story. I know you met with the Prime Minister yesterday, and Canada is part of the international coalition, and our understanding is the Prime Minister intends to raise this at the upcoming G7 meetings. More than ask, what would you like to see that ask look like, especially mental health supports? Are you looking for mental health teams coming from the G7 and the international community to support children in Ukraine?
I think we have to find sustainable solution, which means that probably it's a time to help Ukraine to open a new program in universities to educate new mental health specialists in Ukraine, because we don't know for much time we need such specialists. It can't be just temporary assistance.
Is it something that, also we have a lot of Ukrainians that are abroad in Canada, for example, with the expectation to return and help rebuild Ukraine at the hopeful end of this war. Would it be something that Canada and Canadians and other countries could be helped with training Ukrainians so that they're equipped to return home to this to the end of this conflict, hopefully, that happens?
We don't know. Either we're in the end of the war, in the middle of the war, or just in the beginning of the war. This means that we have no luxury to postpone a lot of things after the war period. We have to start recovery now and to return breath to the local community and provide people opportunity to return home.
Thank you.
Thanks.